Welcome, everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Please be reminded that public health measures continue to be the most important protection to prevent the spread of COVID-19. Stay home if you are sick. Maintain a 2-meter distance from others. Wash your hands often with soap and water, or use an alcohol-based hand sanitizer. Use proper respiratory etiquette by coughing into a tissue or your sleeve, and wear a mask when attending commercial establishments. For area businesses, visit our website to access our Safe Return to Business Toolkit. I will now report our current case counts. There are 111,124 confirmed cases of COVID-19 in Canada and 37,739 cases in Ontario. Chatham-Kent has 188 cases, and Sarnia-Lambton has reported 292 cases. Michigan now has 73,663 cases, with 12,223 cases in Detroit. Today, we are reporting 2,017 cases of COVID-19 in our community, an increase of 35 cases from yesterday. 8 are workers in the agri-farm sector, 3 are healthcare workers, 9 are in the community, and 15 are still being investigated at this time. 1,311 cases have now resolved. 598 people are self-isolating, and 8 people are in hospital. 27% of our cases are between the ages of 20 and 29 years, and 24% are between the ages of 30 and 39 years. 65% are male and 34% are female, with 1% unknown at this time. Our community has lost 69 people to COVID. 49 deaths have occurred among residents in long-term care and retirement homes. There are 2 long-term care and retirement homes currently in COVID outbreak. In addition, there are 6 workplaces in the agriculture sector and 2 workplaces in the manufacturing sector experiencing a COVID-19 outbreak. Symptoms of COVID-19 can range from mild to severe. Some common symptoms include fever, a new or worsening cough, a barking cough, chills, sore throat, and shortness of breath. Call 911 if you have difficulty breathing and are struggling to breathe or speak, or are experiencing severe chest pain if you're feeling confused or losing consciousness. Please be reminded that Windsor-Essex has 2 COVID assessment and testing centers: Erie Shores Healthcare in Leamington and Windsor Regional Hospital Olette Campus. SOHAC in Windsor also offers testing for First Nations, Métis, and Inuit people and their families. To check your results, please go to www.wechu.org and click on View Your Results to access the online test result portal. If you are unable to view your results, please contact the assessment center or the healthcare provider that initiated your test. The health unit will call you if you have tested positive for COVID-19. Please continue to visit our website at wechu.org for the most current information and case counts. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health, for further updates.
Good morning, and thank you for joining us again. With approximately 3,000 to 4,000 new tests that are completed in Windsor-Essex each week, the Windsor-Essex County Health Unit continues to receive a high volume of questions or requests by phone, email, and social media related to accessing test results. The Windsor-Essex County Health Unit is pointing the public to the most efficient way to access results, which will help to keep our phone lines clear so that staff can be as responsible as possible to respond to COVID-related questions and do the case and contact management, and also attend to concerns from residents, businesses, and other community groups. When a case of COVID-19 is confirmed, that is meaning the test results came back positive, the Windsor-Essex County Health Unit contacts all cases directly within 24 hours of receiving the results from the lab. The 24-hour window is mandated by the Ministry of Health, and it's considered one of the metrics for following up with all these individuals. And there are times when this window may be extended when improper contact information is provided at the time of testing, or if there is any reason that the individual cannot be contacted or do not return our phone call. The confirmed cases is contact over the phone by a public health nurse or other Windsor-Essex County Health Unit staff member to notify them about their results, advise them on to the next steps to keep themselves safe, and begin the process of contact tracing and reaching out to all the individuals who may have been come in close contact with this individual. The Windsor-Essex County Health Unit does not call individuals who have a negative test results. To receive your results, we are directing individuals to visit our website at www.wechu.org and click on View Your Results. This will connect you to the Ministry of Health's portal for COVID-19 test results. Some individuals are not able to access results online because they do not have a health card, or the lab that received their result does not post results online at this time. For those unable to access their results online, individuals should contact the center, the assessment center, or the healthcare provider that conducted their result. For a majority of these individuals, this is either the COVID-19 assessment center located at Windsor Regional Hospital Ulad campus or Erie Shores Healthcare in Leamington. Individuals that received their test results at the Southwestern Aboriginal Health Access Center in Windsor should contact SOHAC for their results. All calls to the WICHU or Windsor-Essex County Health Unit related to test results will be redirected to the appropriate testing site. Our website has been updated with this information to make it easier for the community to find phone numbers and access their results online. Please keep in mind that the results are prioritized, and in some cases, it can take up to 7 days to receive your results back. Thank you.
The conference is now unmuted.
We'll now take questions from the media. CTV.
Oh, sorry. Yeah, right off the hop today, eh? Sorry, I wasn't ready. So I just got off the phone with a community leader. A couple of leaders are calling on the health unit to include Section 22 order to ensure all workers are being fed properly and that PPE is provided. So can you give me some insight on that? And I know we talked about it last week, so have you made progress in discussions on that topic yet?
So Bob, I would suggest that you visit our website and look at our Section 22 order. It does talk about the provision of food and the nutritious meal requirement to the employer. Right now, as you're aware, that there are a lot of coordination that's happening through different levels of ministry, through various community partners in ensuring that all these individuals who are self-isolating are in one or two locations that can be appropriately staffed and provided all those care. So all of those things are happening, and we will be following up with all these partners to ensure that everything is taken care of. It is one of the requirement, and it is one of the order that's already there with respect to food and nutritious food in particular.
Okay, yeah, because I saw some of the pictures online this morning, and yeah, I mean, it's, I don't know, it looked like a concern to me. So I don't know if you've seen the same pictures or not, but, you know, are you concerned about what these workers are being fed?
Well, of course, I think it is a concern in general, and I can understand that there's a lot of issues and a lot of advocacy group, a lot of people who are using many of these stories for various reasons. As the medical officer of health, I'm concerned about anyone who is self-isolating. I want all of them to be taken care of appropriately and cared for. So I think it is no different, but obviously when we hear these type of stories, we follow up and ensure that whoever is the responsible agency or responsible authority in that matter is taking care of those their responsibility. And under the Section 22 class order that I've already issued to all the farm owners operators, they are aware of all these requirements. But as I said, that there are a lot of coordination that's happening too, and we will be following up to ensure that that's happening. But I want to make sure that you know, these are the concerns that we should be looking at everyone, whoever is self-isolating, and our messaging even have been in the past, is if someone is self-isolating, ensuring that their family members or others, their neighbors, their friends are checking up on them to ensure that they have access to food supply and any other resources that is needed.
Okay, I'll save my last one for the follow-up. Thank you.
CBC,
Nothing right now, thank you.
Blackburn,
Based on the figures that we've seen over the last 4 days, if you were to be asked right now if Windsor-Essex is ready for phase 3, what would be your response?
Well, I guess we'll have to be very careful in how we are approaching it. Right now, we are seeing some of the community cases as well, and I think we've been doing some of this education for the last since last week, the beginning of last week, reminding people the importance of ensuring that all the public health measures need to be followed. And for the most of the part, as you're saying, is that we are all adapting to the new norm, especially with the stage 2 reopening, with the people wearing the mask and going into these business and commercial establishments. So all of those things are happening right now. And we're learning from other jurisdictions as well. So I think it's just looking at the number at this point, I would be still urge some caution and recognizing that some of these decisions would be a provincial decision. If we move, we want to make sure that our community is taking all the precautions that we need to prevent any surge in the community cases or have more cases outside of the agri-farm sector. Most of the cases are in the agri-farm sector and in some of the communities, and we definitely want to keep it that way.
Okay, thank you.
AM 800.
Dr. Ahmed, just looking at the new website, the layout of it, just looking for some clarification. So right now there's 2017 confirmed cases and then 1311 results. So does that mean that 700 people in Windsor-Essex are still self-isolating?
In most of the part, I want to say yes, and there may be some delay in terms of how our staff are following up with those individuals and clearing them. Sometimes they have mild symptoms, and we are on the side of caution to keep them in isolation before we remove them. But the majority of these people are self-isolating, and in addition, not just these 700 people, but I think all the close contact of these 700 people are also self-isolating. So if you're truly looking at the self-isolating numbers, that could be much higher than that number, whether we're talking about the temporary foreign workers or even the community cases. A much higher number is self-isolating, and our team follows up on everyone who's self-isolating.
At the moment, do you have numbers, how many people are in hospital or the ICU?
Yeah, so Teresa mentioned, maybe you go ahead, Teresa.
So according to the report today, we have 1,311 cases that have now resolved, 598 people, and these would be cases are self-isolating with 8 people in the hospital.
Any of those 8 in ICU?
There are people in ICU. I don't know the exact number.
I think 3 are confirmed, and there are others that are waiting or pending results. But yeah, that's a rough number. I think in total 5 people are suspected of it, with 3 confirmed cases.
Okay, thank you.
Windsor Star.
Just to go off of Rob's question, so the website, in one of the graphs, it says that there are 8 people in hospital, confirmed cases, and that there are 5 confirmed cases in ICU. Is that an accurate number? It does, when you look at the whole graph and all the numbers involved, it does add up to the current case count of 2017.
Yeah, that seems to be the correct.
Yeah, that would be accurate.
Okay, thank you. And then otherwise, you were talking a lot about
test results today. Have staff been sort of overrun by phone calls about the people seeking results of late?
That has been the case, and that's why we feel that it's important that we remind residents that there are other sources for you to get the results. Public health staff, our resources are dedicated to reaching out to the positive and doing the case and contact management. The assessment centers and the physician's office that are doing those testing, they are the best place to access your result. And most importantly, the easiest way is to go online and with some individuals who cannot have access to internet or having challenges with this. So those are the ones that can reach out to the for an in-person or like on the phone type of request to get someone look at their results. But for the most of the part, online results are much faster and are available in most of these cases.
Okay, so the only individuals who should be calling the health unit for the results would be ones who have absolutely no access to the computer or the internet.
What we are saying is the positives, we will be reaching out to all the positive, even if someone do not have access to internet. We are recommending that they should try the assessment center or to their healthcare provider who has done the testing. We want to make sure that our staff time is more focused on some of the case and contact management, and also to respond to some of the other work that no one else is doing, such as businesses and other community questions that we are receiving from the members. In most cases, the assessment centers are already the physician responsible for doing that testing. We rely on them. One system is there, but there is no other system for anyone to access some of the other public health work that we are trying to. So it's not saying that that we are cutting down on our services. The service already exists. We are just redirecting people, and then for
So individuals really have no reason to call the
Health unit to access their test results.
I'll just comment. So every morning I've been saying the exact message that Dr. Ahmed said today. So nothing has changed other than the fact that we want people to be aware that whoever performed the test, the initial test, and if they are not able to access their tests online, they are to return or call the assessment center or the healthcare provider where they actually received their initial test, and they'll be able to follow up on the results. The negative results, we will no longer call or want to be the source of callers for their negative results. The positive, as always, we will contact the person. In some cases, they may have already been provided that information through accessing the online portal or through their healthcare provider. But regardless, we will continue to call and contact people that have tested positive.
Thank you both.
Any additional questions from CTV?
Yeah, just a couple of quick ones here. So let me get my head around the numbers. How many agri workers are currently in isolation? Do you guys know?
I want to say that there are close to, I think the active cases a little over 200, and or 200 or so. Tracy, you remember?
The active cases, many of them are actually isolating on the farm, and some are in hospital, are in hotels, not hospitals, sorry. And the contacts are in the hotels. So in hotels right now, we probably have about 140 or a little bit more. And then the other people are isolating on the farm. And
okay, so all right, so like 140 in hotels, rest of them are in the farms then, right?
yes.
Okay, so that's cool. And
I'm just curious too. I had somebody who called me and told me that mask wearing is at a minimum at some of the facilities that he's seen. So I don't know if you've received any calls on that, but I guess it goes down to the Section 22 with the PPEs and whatnot. So is there a way for you to police, or like is anything being done about that to ensure that all workers in the farms are wearing masks at all times?
So some of these requirements and follow-up is enforced by the Ministry of Labor, and in their visit, they do talk about any type of occupational health and safety measures that is needed. We are aware that the Ministry of Labor is also doing many inspections and visits to these farms to ensure that occupational health and safety measures are in place in these within these farms. So I think any concerns, sometimes if we are receiving, we forward it on to the Ministry of Labor, or Ministry of Labor also acts up on other complaints. And they have issued a number of charges and have done hundreds of inspection in these farms for compliance, and that work is ongoing.
Great, thank you, guys.
Any questions from CBC?
Yes, I was just wondering if the healthcare workers who have tested positive are local or traveling across the border.
The healthcare workers are local from our community.
And today, I mean, we have over 2,000 confirmed cases of COVID-19 in Windsor-Essex. Dr. Ahmed, did you ever think we would see this many cases here?
Honest answer, no. In fact, when the pandemic started, we felt that we may see a few cases and it won't spread across the globe the way it spread. But I think here we are right now, and I think we have done a great job living right next to a state that has seen one of the hotspot in the United States. And so I think our community has done a good job. And the focus right now is ensuring that we follow some of these measures, as difficult as it is to continue to take all these precautions. But I think it is, as a community, it is important for us, and it is a responsibility for all of us. It's not just one person, one individual, one agency. I think all of us are in this together, and we have to work together to ensure the safety and well-being of our community. And we really hope that, despite all these farm cases that we are seeing, which is now getting close to 50% of our case count of the entire region, but still close to 1,000 cases is in our community. And we have a responsibility, and we have to act in the interest of ourselves, our community, and do our part in reducing the transmission.
Thank you.
Any questions from Blackburn?
No, thanks.
AM 800?
No, thank you.
Windsor Star?
No, thank you.
Thank you, everyone.
Thank you.